And now, a moment of education from SURGUCATION.
Ear infections are very common in children. It's common to have around 3 ear infections every year in children. It's most common in young children that are developing, usually less than 2 years of age, but can occur at any age in children. Ear infections typically last for about a week to 10 days, but sometimes can last longer. They're typically treated with antibiotics by your primary care doctor. If you've had too many ear infections, your primary care doctor may refer you on to an ear, nose, and throat doctor to get seen. In general, we have guidelines that are supported by science or research that tell us that it is common to have around 3 ear infections a year. So if you've had 3 ear infections within 6 months or 4 ear infections in 1 year, we tend to think that that's too much. But we try to be conservative with calling infections too much. We think more about how long they're lasting or if they're having effects on your child.